Hello and welcome to our next episode of Smart Life. How are you? So today we have Rick Rodriguez here. He specializes in Medicare. I'm very lucky to have him in our team. So I've joined Rick at a couple of workshops for Medicare and realized very quickly that this is going to be helpful information to our viewers. And so I have invited him here today to talk to the last of our baby boomers and the beginning of our Gen X, because there's so much information. So we're very lucky to have him on our team, and we're very lucky to have him here today. Hello, Rick.
Hello, how
Oh
are
my
you?
gosh. Welcome, welcome. I am so happy to have you here today. Tell us a little bit about yourself, Rick.
Well, let's see. Medicare. We'll start there. Medicare, I've been in Medicare business for a few years now. I wouldn't say I know everything or that I'm the expert at it, but enough to at least help you avoid those penalties. I've been doing it for a couple of years now, and I really enjoy it. I enjoy helping my clients. I really do. Um, Helping them find their doctors. It's a complicated web of information, and being a senior trying to navigate that world, it's almost might as well be in a different language.
Absolutely. And it is. After I went to a couple of your workshops, I was sitting there, I was like, wow, I'm right around the corner from there. I'm not going to tell you my age right now, but I am right around the corner. And I'm going to tell you, I'm very well prepared now. But that's what Smart Life is all about. And you being part of my team, I want to ask you, what made you come further into the financial industry and do insurance and retirement? Since you're doing Medicare, what caused you or what made you make that decision to further, I guess, your knowledge about products that are out there? Give me your take.
Well, originally I came into this business wanting to learn life insurance and annuities. To me, it was important because I had started my own business,
Correct.
and being self-employed, out late, you never know what's going to happen. So I looked into life insurance, got life insurance for myself and my family, and ultimately became a life and health insurance broker, and started going down testing for the life insurance products, but ultimately went with Medicare first because of the health insurance. In this country, we have to have health insurance.
Absolutely. Absolutely.
So that was why I went with Medicare first. And now here I am circling back to the life insurance and annuities, which is where I originally wanted to start.
Absolutely. Do you feel talking to baby boomers? Do you feel there's a need still for retirement plans and insurance?
Oh yes. I believe, especially now with the products, the way that they are and the way that they're designed, they're not like they were designed 20 years ago.
Absolutely.
The boomers, they know one thing and one thing only. So when you try to explain to them how things work, it's either I already got one, I already know,
Yes.
or, they don't have one at all and they're not interested.
Yeah, I see that misconception a lot. They're still working. It looks like baby boomers are working way into their late 70s, still early 80s. My mother in law being one of them. She's in the medical field and she's 80 years old. She's going to kill me when she finds out I
Wow.
said her age, but she's an educator. And her take on that was that you know, she wants to educate because old school way of doing nursing is so different than nowadays.
Yes.
But anyways, they're working way into their late age, and I learned even from her. She had a 401k, and when she was ready to retire, she went to look to see how much money she had, and she had lost a lot in 2008
Oh yeah,
when
the
we
market
had,
crash.
yeah, when the market crashed. I mean, she thought she had oodles and oodles of money, and she didn't. So that made me think. In prior episodes, I have also talked about I was diagnosed with cancer in 2018 and made me think as well. And I didn't have insurance because the Gen X generation, we are self employed. We feel like we're always going to be strong, like we're going to work the rest of our lives, like we don't need retirement, we don't need insurance. And now here we are at this age and realizing, and that's why I got into the industry. But I'm so happy that you shared that, there is a need out there because I see it when I go to your workshops and you've introduced me as Smart Life. and they start asking me questions, and then you come to find out, obviously, they have daughters, they have sons, they have grandchildren that they can help nowadays
Right.
to set them up early, not to make the same mistakes that baby boomers and Gen X did,
Well, I think
you
a
know?
lot of it is too is the baby boomers, they were taught invest in your 401ks, invest in your
Yes,
401ks, right?
yes,
And they all did, but they never told them what to do with it after. Okay, now that you're
exactly.
retiring, what do I do with it? They don't
Correct.
know. And a lot of us don't know. I
Yes,
didn't know.
yes.
I'm barely finding out.
Yeah, I've had a couple of instances where they retired and they knew no different, and they transferred the money from the 401k directly into their bank,
Ooh.
and they got
And
taxed
we all know
severely.
we all know
Yes,
what
it
happens
was
there.
taxed severely. And in other cases, when they leave the job, they automatically transfer it to a company that's going to be charging them fees, even though they're losing money. They're charging them fees, and they're losing with the stock market.
Or they just leave it with their employer.
Or they leave. Oh, yeah, yeah, that's it. Yes.
You know?
So, those are the cases, those are real case scenarios.
Right.
And that's why I love having these podcasts, because we bring it down to layman terms. We bring it down to simplicity so that you understand. So, today, even though I'm an expert at Medicare now,
Yeah, you've been to my workshops. You should
yes,
be.
we're going to tone it down a bit, and we're going to pretend I don't know anything about Medicare. Okay.
Okay.
I'm going to turn back to you guys. If you're turning 65 or if you're in your early 60s, Medicare doesn't have to be confusing, but you have to be well aware of what's going on with Medicare. Don't wait to the last minute. Don't procrastinate. How many times do you see that?
Oh,
People wait to the last
way too
minute.
many times.
Okay. Well, there's consequences to that, just so you know. So, what we're going to break down today in simple terms, what do you need to know? What to avoid, and how to make the right decisions so that it doesn't cost you money in the future. So, making the wrong move in Medicare can cost people thousands of dollars for the rest of your lives. Is that true or not?
That is correct. There are lifetime penalties. That is correct.
So, we're going to take our first viewer and we're going to ask them what questions they had.
Hey, Smart Life. What is Medicare and who qualifies?
So, what is Medicare and who qualifies for this?
Medicare is the federal government's insurance program. In the United States of America, we have to have health insurance, and that program is offered to us when we turn 65. So when we turn 65, the federal government offers us Medicare. That's the name of their insurance company. There.
Is Medicare just a California thing?
Medicare is not a California thing. Medicare is nationwide. It's all 50 states.
Got it.
In California, we have what we call Medi-Cal, or and the proper term is Medicaid. It's called Medicaid, but
Never
every
heard that.
state has their own. We call it Medi-Cal. In Hawaii, it's called Quest. In other states, it's called Tennessee, it's TennCare. And some other states, they call it all different things. But there's ways to qualify in that state. You have to qualify, typically low income,
Correct.
based on your income. So they will ask, about your income and your assets and things like that.
Perfect.
You either qualify or you don't.
The next question.
Hi, Smart Life. My question about Medicare is when should someone start enrollment in Medicare?
That's the big misconception. People think that after they turn 65, let's enroll. Is that correct?
No, actually, you want to start to look into Medicare, I would say at around age 63, because you're eligible to enroll at age 64 and a half. So around 63, 64 is when you should start looking into it and try to figure out what it's all about.
Does Medicare cover everything?
Medicare does not cover everything. So there are two parts to Medicare. There's what we call a Part A, and there's a Part B. The Part A is for inpatient services, and our Part B is for outpatient services. Outside of that Medicare will only cover so much of those services. So Medicare will cover 80% of those services. So if I end up in the hospital and I need to have services done, they will pay up to 80% of the coverage, and I'm responsible for the other 20%.
Got it.
So we as individuals have to have options for coverage on that other 20%.
I know the viewer had a question about that. So, how many plans is there? So, let's ask the viewer what the question was.
Hey, Smart Life, when it pertains to Medicare A, B, C, and D, can you tell me a little bit more?
Okay, so once again, Medicare's Part A, B, inpatient, outpatient. So in the hospital, outside the hospital, things like physical therapy, my primary doctor, I need to get an x-ray done, so on and so forth. Being that Medicare will only cover 80% of my bill, I have to cover the other 20%. So if my bill's 10,000, I got to cover the 2,000. Well, there are insurance companies like United Healthcare, Humana, and Blue Cross and Blue Shield, all the private insurance companies that offer us insurance to help cover that other 20%. And in return, they also provide us with things like dental coverage, vision coverage, and other services that are not covered by the A and the B, what we call original Medicare.
Okay.
So C and D, that's Part C, Medicare Advantage. Part D is prescription drugs.
Got it. Well, that was easy. No, it isn't. There's so much to this, and that's why it's so important that you are well versed way before you're 65, just because there's those questions. What is A? What is B? I mean, you heard it here just real quick. It took me going to several workshops to understand A, B, C, and D. And what I noticed is that even the participants that go to these meetings, they're there every time he has a workshop because there's so much to learn. You'll capture a few things on the first workshop, then you'll capture a few other things on the second workshop, but it is very complex, and it is very important that you are well informed of what you're enrolling into.
What your
Okay.
options are.
Yeah, and what your options are. Absolutely. So I know that people are bound to ask what the cost is. So let's look at our next viewer.
Smart Life, is Medicare free? Thanks for your help.
Great question. Is Medicare free? I'm going to say yes and no. Going back to original Medicare, our A and our B, Part A is free to us. When I say us, I mean U.S. citizens. You have to be a U.S. citizen in order to qualify for Medicare. That part is free because we work, we pay our taxes. Those taxes that they take out of your paycheck every so often when you get paid, depending on when you get paid, goes into the federal government. Like I said, the federal government offers us health insurance when we turn 65. Some of that money that you've paid into is that health insurance. So now at 65, you get Medicare. The Part A, inpatient, is free, but the Part B is not free. That does have a monthly premium. Currently in 2026, it's $202.90. That is the lowest of the premiums because that premium is based on income.
Okay.
So if you're a high earner, expect to pay more than the $202.90. But at the bottom tier, it's $202.90.
Perfect. If you're trying to figure this out on your own, this is where timing matters. So let's take the next question.
Hey, Smart Life, I have a question. If I'm 65 and I missed open enrollment, are there consequences? What should I do? Thanks for your help.
Yes, what happens?
Oh,
This one was a big one. I was so shocked when I heard this. And I said, there's no way. I even said, it's unfair. How can they do that? But then again, we get taxed for everything. So I guess everything is fair at this point, right?
right.
So tell us about those penalties if you miss enrollment. Please be very specific, very clear what can happen and what will
Well,
happen.
there are penalties for multiple reasons. One is for not signing up on time.
Mm-hmm.
So when you first become eligible for Medicare, which is at what age, Linda?
65.
Exactly. So if you don't enroll into Medicare when you first become eligible at age 65, there is a penalty. Now, that's why I say start at 64, 63, start looking into it because when 65 comes, you want to make sure that you're prepared to help avoid that penalty. I tell all my clients, people I meet in passing, get your Part A. It's free anyways, right? Avoid that penalty. It's free. If you're going to continue to work and you have insurance through your employer, you're going to be covered. But once you retire, it's time to leave that employer. You need to sign up for that Part B, the
Yes.
second half. If you don't, there's a penalty. You have 60 days, 63 days to make a decision on what you're going to do. Let's say you do that because you came to visit us. You avoid that Part B, but you're not done yet. You still need prescription drug coverage.
That was our next
Remember,
question.
Medicare's Part A and B is only inpatient, outpatient. It still doesn't cover my medications. we have to have medication coverage. We have to have that. If we don't have that, there's a penalty. And that penalty is for life.
For life.
Penalty is for life.
So that's where I say it's so unfair, but it is for life. So be proactive, learn everything there is to learn about Medicare and enroll, you know? So you did answer the next question. Nobody asked this question. I was going to ask that question. So you took that right out of my mouth. But yeah, my next question was prescriptions, you know?
Prescriptions.
So turning throwing a curveball at you guys, prescription is a whole totally different animal, you know? I know it's not so easy to change from plan to plan. And the one thing I learned is, so I have a quadriplegic brother and he automatically qualifies for Medicare. Is that correct? Because I didn't have to enroll him. It automatically happened for him. And I can't take him out from one plan to another because the other plan might not cover his medications, correct? So every enrollment period, I have several companies calling me and saying, hey, would you like to switch over? And then, it sounds all fine and dandy, but then I come to find out that his seizure medication is not taken care of. And so I did the mistake of transferring him.
Mhm.
And then we had to pay out of pocket until we were
Oh.
able. I sent a letter, and somehow or another, we got him back into his
So
original
you
plan.
found out the hard way.
Yeah,
what
I found out
happened.
the hard way. So those are things that you really, as we age or not even age, I mean, people are on medication for different reasons, whether it's high blood pressure or diabetes, which is a big thing now, right? But some people lose it.
Well, these call centers, they prey on some of these older seniors,
Yes.
They lure them in with, well, you guys see the commercials, get your $2,500 in food credits. With the way cost of living is now here, I mean, who doesn't want $2,500 for food? I'll take that too.
Yes, yes,
You
yes.
know,
I didn't even know
so-
that existed, but yeah.
So, and when I hear that as a broker, I know $2,500 for food does not exist. Otherwise, I'd be offering it to you.
Yes.
So when I have a client like that, she did the same thing. She switched plans on me because they offered her something else. And now she's finding out that her current doctor does not accept that insurance plan.
Correct.
And now as the broker, I'm left trying to figure out, how do I get her back? How do I
Yes.
get her back?
Yes. In my case scenario, I was lucky he's handicapped. They know the severity of it. But now that we got prescriptions out of the way, we now know how Part A, B, C, D works, who qualifies, what Medicare is. But the next question was a very interesting question. And I remember that question coming up on one of the workshops, but that's a very good question to answer. But there's also a misconception because just because you work, you think that Medicare is going to follow you, or not Medicare, the person that is working thinks that they have insurance till they stop working, but that's not the case. So listen to the next viewer.
Hey, Smart Life. If I'm 65 and still employed, do I have to enroll in Medicare?
Exactly.
So yeah, so kind of what we were talking about a little while ago about if you have insurance, what they call credible coverage. So Medicare will pay so much. So you have to have insurance, what they call credible coverage, which means the insurance that you currently have will pay just as much as Medicare, if not more. It has to be just as good, if not better. So most employer companies offer insurance that is what they call credible coverage. So we're good there. But kind of like going back to what we talked about as the enrollment, you have so much time to make that decision. Okay, so depending on when you're going to retire, most people know when they're going to retire. People that I know, they know to the day when they're going to retire. Like that's it. My last day is this day. So when that day comes, you're supposed to call me at least a couple months in advance and say, hey, Rick, I'm going to retire. It's time to start either enrolling Part A and Part B, or if you already have the Part A, finish with the Part B, and then we can start with the other process, which is the C and the D and all the other half.
The same applies if you're self-employed?
Self-employed as well. Being self-employed, you still have to have insurance. I'm self-employed. Luckily, I'm married to a beautiful wife, and we have insurance through her employer. So even when my wife retires, or when she retires and I lose the coverage through her employer, I got to figure out what I'm going to do. That time will come.
What about semi-retirees and they still have a part-time job, and if they offer benefits, it's the same thing. Same thing applies, correct?
Okay, so now that's a little bit more tricky because I do have clients who are retired and they continue to have insurance through their employers, which is fine. There's union workers, people that work for the aerospace company, and they have great benefits to their
Yes.
employers. Now it comes down to cost because remember 20290 is the part
Oh,
B.
yes, yes, yes.
So if you're paying more than 20290 for your medical insurance through your employer, then it's going to come down to, okay, what's more beneficial? Is it cost? Is it your doctors? Is it the benefits? You might be paying more, but what are you getting for that cost? So really that's where the expertise of a broker like myself can sit down and go over all of that with them.
And that's exactly what I covered, that you have to be not just well informed. Don't try doing this on your own. Be guided by a professional such as, Rick here. So before we wrap it up, I want to hear about, and nobody asked these questions, but what are the common pitfalls, the common problems that you experience, being in the Medicare industry?
There's quite a few, I would say. One is just not being educated. A lot of people procrastinate and they just kind of wait to the last minute. That I don't recommend doing with something like this because of that lifetime penalty. And it's your health. We all know as we get older, our health is the first thing to go. Um, and don't be afraid to talk to somebody like myself. Reach out, even if it's not me or Linda or anybody else, someone local to you that can help answer those questions because we're going to know what's best in that area. These plans are all designed for your county, the zip code that you live in. We're in the community, so we know the doctors, we know the specialists.
There you go. So there you have it. Medicare Talk with Smart Life and Rick Rodriguez. And Medicare doesn't have to be confusing, but it does require guidance. So call Smart Life at 949 Smart 30. Again, that number is 949 Smart 30 to connect with Rick Rodriguez or any of our agents, our smart agents. That's why we call it Smart Life, because we have very smart agents that can talk to you about insurance, retirement, celebration of life, pre-need, Medicare in this case scenario, and even services that we don't per se sell, like let's say trust, living trust. We are collaborating with lawyers that are helping our families, set up themselves from A through Z. That's going to be probably our next podcast. We're going to go over putting your affairs in order. Like nobody knows. Nobody, I mean, I've talked to some of the most educated individuals that feel that they've done their whole 9 yards. They have a retirement plan, but they haven't visited their trust in over 10 years. And I ask them, you know, any new babies, oh yeah. And, they tell me they have like 9 grandchildren, but the trust hasn't been updated. There's those case scenarios. I'm dealing with different families that I have helped in the last 2 months. And they're going through problems like they don't know their loved ones' usernames and passcodes to their accounts, to bank accounts, to social media. Social media is still open.
One of the beautiful things that I do with my clients is I treat them like my mom. My
Yes.
mom does not know one password. Okay.
Yes.
She writes them
Yes.
down in a little book, but when I go to look at that book, she doesn't know which is which. They're just written down. So I take it into account to organize. Obviously, we have a system that we put our clients in. So I keep track of all their passwords and IDs just in case,
Yes.
they need it or where you need to sit down and we need to log into their social security account. We can pull up a statement or we can order a new ID card. I have that information and they're not trying to fumble through it, trying to find it.
Yes. But it's very important to have all this information so that if an emergency happens, it doesn't have to be death, but if an emergency happens, the family knows, they don't have to jump. Yes, it's good to have a plan. And that's what Smart Life is all about. It's planning for the future to be better prepared. So again, that number is 949 Smart 30 to get a hold of one of our professionals. So in closing, I just want to stress that we strive to help you make informed decisions to avoid making costly mistakes. Well, that wraps it up with Medicare. Do you have anything else to add to this?
Don't wait till the last minute.
Exactly. So at Smart Life, we don't leave our future to chance. We build it, we protect it, and then we pass it on with purpose. Thank you for joining us.
Thanks, Linda.
Yes, thank you.
That was good.
Yes.
I was a little bit nervous.